Hi, Mr. Schwarzenegger. My name is Colin. I'm a nurse practitioner student at Franciscan Missionaries University of Our Lady in Baton Rouge. So you're in clinic here today, and we're going to talk about your recent diagnosis of appendicitis, right? I know you're with us for your follow-up visit since you just had it removed to the hospital. I just want to make sure that you completely understand everything that happened from the beginning to today before you get out of here, and then we'll just check that surgical site and make sure it's healing up good. So first, what is an appendix, right? So the appendix is that little finger tissue that sits on your cecum and just kind of wiggles there. So what's a cecum? When your small intestine meets your large intestine, where they meet, that's called the cecum, and that's where your appendix just kind of hangs out. Appendicitis is pretty often. I think it's one that a lot of people know about, right? They say 250,000 people in the United States have appendicitis every year. They don't really identify very many risk factors. One thing they say is being a man can actually increase your chance of appendicitis. Say you have a 8.6% chance in your lifetime as a man to get appendicitis, where ladies just have a 6.7%. They also say that you have a 75% chance increase if you're white in the United States to actually get appendicitis versus all the other races. So let's talk about what brought you into the office, right? Your signs and symptoms. I know that you said your pain started at 6 in the morning like that, you know, it just hit you like a ton of bricks. You had pain in the right side of your abdomen, you had fever, you had nausea, you had vomiting. Every time that you moved around and manipulated the abdomen, you experienced pain, walking, bending, lifting, all these things. So, but then, like I said, when you got that fever, that's when you decided to come in and get checked out. Some other stuff that you didn't experience, but some people might, is sometimes they may have trouble passing gas, or they feel like when they have a bowel movement, actually temporarily relieve some of their symptoms. So when you came to the office, the first thing we want to do is just do a physical assessment on you, right? So we put you down on the table after we got your vital signs, and we did something called a psoas test. That's where we lied you down on your left side, put your knees out, and then we grabbed your right thigh, and we just passively extended that hip. And you had some pain in the right side of your abdomen, so that's a positive psoas test. Makes us suspicious of appendicitis, because as that appendix gets inflamed and enlarged, it spreads out. If it gets down far enough and we manipulate those muscles and ligaments in your thigh, if they actually hit that appendix, it'll cause you some pain. So we were suspicious. So then we did the obturator's test, and when we put you on your back and we bent your knees up at 90 degrees, grabbed one ankle and grabbed your knee, and we just slowly we just slowly rotated that hip internally, and you again experience pain. Both these are signs of late appendicitis. Just to be a little bit more confident in our diagnosis of you, then we started to palpate your abdomen. We didn't start where you hurting. We actually started on the opposite side, on the left side. We pushed down on the left side of your abdomen, and you started to have pain on the right side of your abdomen. That's called Rovsing's sign, which makes us super suspicious. Now, if you didn't have a positive Rovsing, then we actually would have palpated over what's called McBurney's point, which is if you take your belly button and you put 2 finger breadths away towards the right side of your abdomen, upper right side of the abdomen, that's what we call McBurney's point. And that's commonly referred to as the area where exteriorly we have the appendix meeting the cecum under that. So pushing right on top of there, if your appendix is even just a little bit inflamed, you'd have a lot of pain. So given this, we decided to do some lab work and send you in for a CT scan. So your lab work showed elevated neutrophils and leukocytes. Fancy terms for your white blood cells are high. Makes us suspicious that you had an infection. We also had an elevated CRP, which is C-reactive protein, which again just tells us, hey, there's a little inflammation somewhere going on. Just added to our suspicions. But then we did that CAT scan with oral and IV contrast, so we can actually visualize your gut and visualize that appendix. So we saw, well, say we, a radiologist saw that your appendix was inflamed and told us. Doesn't get any more definitive than that, that seeing it's like that. So some people do ultrasound, but over here we just do that CAT scan. So we sent you in for surgery. You had that surgery done. So what are some preventative measures you could have taken to stop this from happening to you? Not too much. You could say a little prayer and a little voodoo dance, but there's nothing that's going to stop it in your house. It's just bad luck. It's just stuff that happens. You can get tumors, like growths right there, that can block up that appendix. You can get an infection somewhere else in your GI tract that works its way in there. You can just get a little random abscess in there that then swells and walls off that appendix. You can have inflammatory bowel disease that can just cause it to become inflamed. You can get poop that gets impacted in there and then just can't get back out and it gets inflamed. You can get parasites, right? That gets in there and then have that from going on. So let's just check out your site, and if you have any questions, I'd love to answer them for you. I'm very pleased to meet you, Mr. Schwarzenegger. Yeah, have a good day.